Hello, my name is Violeta Galdino, and I'm going to start this video talking a little bit about myself. I lived in Passaic, New Jersey for the last 18 years. I am a mother of 4 children, and I've been attending Ashford since 2009. This is my second to last class. I'm working in my bachelor's in child development. My father passed 4 months ago, and when he died, that brought me up a lot of feelings about my medical career. It was my dream to become a doctor, but then I just decided to go for an education degree because I also like teaching. The first 3 priorities that I think that our nation should be concentrated is our youth. Our youth is like the strength of our country, and right now there are many youth that are not going to school for many reasons. Some of them are involved in drugs. Others are having children in a very early age, which they need to leave school because they need to support their families. For instance, our high school here, they have a child care next to our high school because the rate for high school graduates was very low. And they find out that the reason why many of them were not graduating was because of many problems, children and other situations. So we should be more focused and ask questions like why our generation is so different from this generation, what it's missing, why our youth is like so into so many things. It should be better because now we have more technology that could help our youth to be better educated. The second priority is our senior citizens. Statistics show, I was reading a report for this class, that by 2050 there will be the population of senior citizens over 60 years old will triple. My father died of esophagus cancer, and it's very sad all the things that I had to go through so that he was able to get a surgery that will relieve some of the pain, because there were doctors that were not able to accept his insurance, and others that were able to accept his insurance were charging like 20 to 30% out of package expense to be able to see him. And I know a lot of people that are going through this situation, and it's sad. They were the ones that worked hard for us to have the country that we have today, and I think that they are supposed to be treated with dignity and respect now that that they are in their last days, and to give them some relief. Chronic disease, can you imagine if they are surviving in their social security check and now they have to pay for doctors? That will be so bad on them, because how can they then will be able to pay rent and other expenses? The third will be our healthcare reform. We should concentrate in finding the way how to give insurance to all our population. The American population is going through a lot with this reform. I don't agree with the Obama's healthcare because it benefits one group and then it's not good for everybody. I think that employers should give their insurance to their employees. For example, I work for UPS and they give me insurance there. I am not happy at all, a little bit, because I need to pay close to, I say 10% out of my paycheck goes to healthcare. But at the same time, I'm happy that I am able to have insurance. Insurance is very important. In here in New Jersey, for example, the first thing that they ask you when you go to any hospital or doctor's offices, how are you going to pay your bill? I don't see that they care about your health. They just care how that you are going to get paid. And I think that if everybody has access to a better health care coverage, they will not be asking for that. I think that it's important that our nation concentrate in these 3 priorities. I know that there are more out there that I should mention, but I'm just gonna stay with these 3, and they are healthcare, senior citizens, better services for them, and also our youth. I hope that everybody has a great class. Thank you for this opportunity. As I said before, this is my first video, so I hope that everybody are able to understand what I said. And good night.